The capabilities of modern healthcare are quite a marvel when compared to what was possible for the majority of human history. With some exception, many with access to such medical treatment do not have to fear a large number of injuries, infections, and diseases as life altering or life ending, like they were considered only about a century ago. What we now might consider minor medical incidents that are easily treatable used to fatally conclude after futile efforts by doctors and surgeons who often made little difference in the outcomes for their patients. But currently, things look much different. In short, we expect our medical treatments and practices to work. However, it took the medical field many generations of innovation to get to the standards we've come to presently expect. In the 1860s, a British surgeon named Joseph Lister dramatically changed the outcomes of human surgery after better understanding disease and effective operation. He studied the work of Louis Pasteur, who is now infamous for his discoveries in microbiology and the development of pasteurization, as well as the foundations of vaccination. Before Lister's achievement in pushing the field forward toward modern medicine, the chances of dying in surgery were higher than the chances of surviving, meaning the most likely outcome of going into surgery was death. But through his work and study, Lister learned that the diseases that set in during most surgeries were caused by microorganisms, and that doctors and surgeons simply needed to do a much better job of operating with pristine care and technique. He toyed with strategies of how to best keep germs and disease from reaching wounds, and concluded that there needed to be a septic barrier between the surgeon, including their hands and instruments, and the patient's wound. He began using antiseptic spray, which accomplished exactly this. With his innovation and strategizing, surgery became dramatically much more successful, and mortality rates at the hands of surgeons plummeted. Another surgeon at the time, who was also trying to minimize the harm caused in operation, was amazed by Lister's work, saying that Joseph Lister had transformed surgery from a, quote, hazardous lottery into a safe and soundly based science. As helping professionals, we are all in the same field of trying to make people better. The only difference is that our method of operation is the conversation with our clients. With this being the case, I believe that the solution-focused approach has given us the same huge steps forward that Joseph Lister's ideas and antiseptic spray gave the field of surgery. Much like medicine, the psychotherapy field has come a very long way from its clumsy beginnings, but through much needed innovation and understanding, things have dramatically changed. Now, as solution-focused clinicians, we know the same pristine care for our work on human hearts that Lister had to realize for his work on human bodies. We know that this is life-giving work if done properly. We know that therapy has its best chances when we hold off the harm that can naturally set in, the diseases of doubt, rumination, and hopelessness, and instead have a very precise conversation that allows the client's best self to flourish as it naturally wants to. The field of surgery had to realize that they needed to work in a very specific way to overcome the inherent risk of harm, or else their work was just as useless as doing nothing at all. As we ask specific but meaningful questions, and as we cradle our clients' words with just the right care, we are accomplishing this task of working to overcome that futility. No surgeon can undo the injury or take away the problem that brought their patient to the operating room, just as we cannot take away the problems our clients might face. But every good surgeon is very intent on doing careful, intimate, precise work right where the patient needs it, then sewing them up and allowing the miraculous mechanizations of their bodies to do the rest of the work of seeing them through a recovery from the problem that brought them in. The patient then leaves the operating room in the condition to heal, grow, and move forward. I hope this is a useful reminder of the power of the work we do, a reminder of the harm we help to reduce and the life we help to give. It should also be a reminder that the act of therapy is not inherently entitled to favorable outcomes. The chances of dying in surgery used to be higher than the chances of living, Therapy needs to be done in just the right way to save the client. Lastly, I hope this reminds you that the heart is a beautifully precious organ that, even with the best intentions and an abundance of compassion, still needs very tender care when operated on.